My name is Emily Lichtenberger, and for this week's class assignment, I am going to be discussing two specific leadership styles as they pertain to healthcare and how they help healthcare leadership evolve. Before I dive into the two leadership styles that I wanted to present in this PowerPoint, I want to talk about the importance of leadership as it pertains to healthcare transformation. Healthcare is a forever changing organization. There are always new policies, new procedures that are put into place, and it is important for healthcare facilities, especially, to have leaders, whether that's a manager, a director, a C-suite executive, within those leadership roles, so they have strong leadership leading the organization to success. So I was reading an article from Bronning that was published in 2016, and it's this first quote here. So hospital administrators and medical professionals have operated within a challenging, rapidly changing, and fragmented healthcare system. So for example, I always like to bring up COVID-19 because it was an extremely challenging time for all healthcare organizations on top of healthcare leaders. We were continuously changing our policies that were put into place. We are now requiring patients to wear masks. We are now requiring patients to take their temperature before they even come into the hospital to see a patient. If they're, in an outpatient facility, taking their temperature and wearing a mask. And if they had the slightest temperature, we had to reschedule their appointment. So that's one challenge that kind of brings up when it talks about healthcare transformation leadership. One day we're going to have to wear masks and take our temperature, and the next day we're running as normal before COVID-19 days. So healthcare transformations require key stakeholders, planning meetings, and open communication with all involved. So again, this is going to require strong leadership and a strong team that's going to lead the organization from their current state to their future state, which is ultimately can be known as leading in the quote unquote gray. Like leadership, healthcare transformation requires four things from a leader. And these are four things that I think are pertinent for a leader to have. So you have collaboration. It's where you take, me as a primary care practice manager, I collaborate with our facilities manager to make one of our outpatient departments more appealing to the eye, increase patient satisfaction scores. Then you have transparency. This one goes hand in hand with being a manager over a group of staff members. Providing transparency to them is one thing that I, as a manager, will forever keep at the forefront of my leadership. I think it's important to, while we need to keep things to ourselves, there is a time and place for transparency with staff members and providers. Then you have integrity, just showing that, even through changes, you're going to fail, you're going to succeed. But at the end of the day, we all have one goal, and that's to make our healthcare system a better place for not just us as workers, but also for our community that we're serving. And then you have empathy, just reaching a hand out to an employee or a staff member that you're over and be like, hey, I can see that you're going through a difficult time. How can I help? Or what can I do to make your day better? Bringing them just something to help lighten their load and make them remember why they're in the healthcare organization in the healthcare field. The first leadership style I want to bring up is one that I actually truly enjoy and use in my everyday life as a manager. So this is called adaptive leadership. Adaptive leadership, as stated with the WGU Western Governors University website, is a practical approach to solving business issues, guiding leaders in identifying and focus on the important aspects of a business operation and discarding what it can do without. So this one is seeing, for example, financially, we have a certain type of paper towels that are stocked within all of our departments, all of our inpatient units, our exam rooms, and we take that and we find something that's less expensive. So that's a financial sustainability initiative, to just that little tweak. What can we do without these really good paper towels? And still, we can do it with the paper towels that are not high cost, but it still gets the job done. kind of situation. So there's 4 pillars to adaptive leadership. And so I'm going to go over these ones. So the first one is going to be emotional intelligence. This is something that I recently learned about over the past 2 years, was how important as a leader it is to have emotional intelligence and not get your feelings involved when somebody's upset or somebody is angry or frustrated with a process, workflow, another employee, et cetera, et cetera. So emotional intelligence, so workflow or a workplace, excuse me, a workforce that feels, hears, and supported is much more likely to put in the hard work it takes to help achieve company goals. I think as a leader, you have to have that emotional intelligence. You have to be able to listen to your employees, listen to understand your employees that you're over, get their feedback, and hear their cries. When I think of emotional intelligence, I have one employee right now in particular who we have what's called a pod structure within our primary care offices. So it's 2 providers and it's 3 support clinical staff. So we have one nurse right now who's extremely burnt out because her provider is not following the proper workflows that she's supposed to, and it's putting a lot of added work onto this nurse. And so in order to decrease her burnout and hear her, what I would call cries or just disgruntled and kind of what's making her like want to leave the company per se, we're going to be moving in between our pods, and the 3 people that are assigned to the 2 providers will now do a rotation, so we can decrease that employee burnout. So that's emotional intelligence. Trust, having your team to be able to trust you, but also make the changes necessary to make sure your staff feel heard, and they don't get that burnout. Then you have organizational justice. So this one is adaptive leaders must be open and honest, even if the truth is hard to hear. One quote that I always live by when it comes to this is, even if you don't want to admit it, sometimes you have to go in and, report someone for something that they did. If you see it and it's not right, speak up. Organizational justice is, you have to be open and honest. You have to be welcoming of other people's ideas and thoughts because everybody is different. We work in such a diverse environment and with diverse people that organizational justice is a must. And then there's development. Adaptive leaders love trying new things. They also have the propensity to innovate and experiment and are not afraid to fail in the process. One thing that I constantly tell my team is, hey, we're going to implement this new workflow. I want your feedback on it. We're going to check in at 30, 60, 90 days. And if it's not working, we're going to adjust it. That is something that I've absolutely loved doing as it pertains to leadership and within my practice. It just kind of lets them know like, oh, look, like my manager doesn't know everything either. And it makes them feel a little bit better. It makes them feel a little bit more comfortable. They're more apt to come and talk to you as their manager. And they're more apt to try different things and know that it's okay to fail. One thing I always tell my employees, I was like, it's okay if somebody comes around and asks you a question and you say, I don't know, but let me check into that for you. I constantly lead by that type of example because we are human. We all are human. We all make mistakes, and we're not going to learn by just sitting back. We're going to learn by knowing, by doing, and moving forward. The last pillar of adaptive leadership is character. So as much as they welcome change, an adaptive leader also embraces diversity and finds a way for it to benefit the entire company. For example, I've been in my primary care practice manager role for a little under 2 months now, and coming in, the culture and morale was down in the dumps. It was terrible. I implemented different ways for the schedule to work. I would send out emails, but then I would print it out. And if I had some people come to me and be like, hey, I think that this would be good to add to your schedule, or try it this way, like this is how we used to do it. I think that taking that advice and just kind of making little tweaks makes it a lot better. So now they're not only getting a printed out schedule, they're getting a weekly schedule. I'm doing every Monday, I'm sending an email out with that schedule with stuff coming up for the week. Fridays, I'm sending a recap email. And then I'm also printing out a colored schedule and giving it to all the providers as well. So everybody's on the same page. So character is just knowing that some people like things differently, and it's okay to tweak your own things as a leader to make it that much better for your team and more responsive from your team as well. So the second leadership style I chose was transformational leadership. Transformational leadership focuses on how leaders inspire followers to exceed expected performance by articulating a compelling vision, stimulating intellectual growth, providing individualized consideration, and modeling exemplary behavior. This is from a reading I found written by Brown back in 2025. And I absolutely love this definition of transformational leadership because it talks about stimulating intellectual growth. As a leader, one thing that we have to do is we want to, let our employees know that there's room for growth, whether that is going and getting your master's degree or furthering your education, or it's just growing in the current career that you're in. There's always room for growth. And then also just individualized consideration. Again, that knowing that not everybody's the same, knowing that diversity and inclusion are important when it comes to healthcare. So for this one, like the previous leadership style that I talked about, there are 4 pillars. So the first one is intellectual stimulation. So encourages creativity, problem solving, and continuous learning. So it's just like I talked about. For an example, I have, CMAs, plenty of them. And one thing we talk about in like performance evaluations is, where do you see yourself in 5 years? How can I help you get to your end goal in your career? How can I get you to that next step in your career? I am very much I enjoy helping people, and I enjoy even more watching them succeed. So just knowing that we all can solve a problem together. We're all at the same end goal, which is to make healthcare better, improve our patients' lives, and increase that patient satisfaction within our rural community. Second one is individual consideration. So we focus on empathy, active listening, and personalized support. I have always said my door is an open door policy. If I'm closed, I'll put my door thing stating like in a meeting, but I am very much an open communication, open door policy type of manager. I focus on that active listening. If I'm doing something and an employee says, hey, do you have a minute to talk? I put down what I'm currently doing. I know where I'm stopped at. Or I tell them, hey, give me 1 second to finish this and then I'll be with you. And doing that has helped just build that rapport, build that trusting relationship with them. Inspirational motivation communicates vision and enthusiasm to unite teams around shared goals. I am very much a glass half full kind of person instead of glass half empty. And one thing I actually pride myself on is my communication skills. I am very quick to follow through. I am very quick to, put down what I'm working on to listen to someone who absolutely needs me in that moment. And then I just help them realize the bigger picture. Like, again, we are all in this together. We are going to be one team. We are going to get to that end goal. And then for the fourth one, idealized influence. So leads by example, setting high ethical and performance standards. This is something that I'm actually currently working on. I've got a quality board. We're going over our hypertension and our cervical cancer screening, health maintenance right now in the offices. And I am just setting like high expectations of what we need to do. We're adding certain KPIs to our boards and making sure that we're hitting those. So one issue we found around our hypertensions and why our care gaps aren't being met is because we're not validating the blood pressure cuff for the patient. It needs to be done yearly, and just with a little tweak of getting 2 or 3 patients who are on hypertension medicine or have that diagnosis of hypertension, we can move our needle and just increase those performance standards that we have. So the reason that I picked both of these leadership styles is because they both correlate around the type of leader that I want to be. So when I switched from clinical to leadership, I really honed into what type of manager would I want to have if I was a frontline leader? And that is what I have lived by for the last, couple years as I transformed into a leader. And I think that it has truly driven my leadership style and put a positive emphasis on coming into the practices and helping the team out. So similarities with adaptive and transformational leadership, they're both change drivers. No matter how you want to look at it, whether it's long-term, short-term, they're both change drivers. They push to go from a current state to a future state, and they hit all the barriers in between. They take time to really figure out what the barriers are, mitigate those, and keep continuing and moving forward. They're both employee empowerment leadership styles. You want a team that is going to be able to push through on a day their manager takes PTO. They're going to be able to figure out their resources, and they're going to be able to ask the questions, or they're going to be able to say, as I previously stated, I don't know that answer just yet, but let me get to it and I'll get back with you. Vision driven. This one goes hand in hand with change drivers. In order to make changes, especially in healthcare, you have to have a vision. You have to have a model. It does not have to be perfect. It does not have to be something that you're going to solve right then and there, but you're going to drive your vision. You're going to go through your barriers. You're going to win some days, you're going to lose some days, but you're still at the end of the day not going to lose sight of what that vision is. Continuous learner. Like I stated previously, some people don't want to go and get another degree. Some people just want to stay in their career field, as a CMA, as a nurse, and they just want to be the best nurse possible. They're going to dive into learnings that are going to help them be the best nurse possible. They're going to dive into what other providers do. They're going to tweak workflows with their providers. And they're just going to learn something new, whether that's a new specialty or a new procedure that a provider is doing. And then last similarity that I have about these two is resilience. We're going to fail. We're going to fail, but having a positive attitude and showing resilience and showing that we can still keep moving forward is the end goal for all healthcare organizations, or so I believe. Resilience is something where even if you get knocked down, you're going to get back up. Even if, our hospital organization doesn't gain critical access designation, we're going to get back up and we're going to figure out what we need to do to keep moving forward and to keep pushing that needle forward to become CAH designated. And then to offset those similarities, I found some differences between the two. And this is why I think that these are like two really good leadership styles for healthcare. So adaptive learning. You're navigating large projects. You set the expectations within that adaptive leadership, what your deadlines are, what your end goal is versus your current state. You select your stakeholders, you select your ad hoc attendees. The only thing that I really don't like about adaptive leadership is you lack a clear-cut solution. However, with transformational leadership, you're able to push and hit those long-term goals because you don't lack that clear-cut solution. You're peeling back that onion. And while adaptive leadership does not have a clear-cut solution, eventually, once you get through those stakeholder meetings and you navigate the project and pull back that onion, you're going to have a clear solution as to what that is. And then that then changes into a different leadership style. So then for transformational leadership, it inspires, it motivates. These are two big things I feel like healthcare has lacked for a while. We are so burnt out. COVID came and we're still recovering, 5, almost 6 years later from COVID. And there are some people that left bedside because of COVID, because it was so terrible to deal with. You've got a set long-term goal. You look at your current state and what your future state looks like, and you figure out everything in between of how you're going to get there, which is how my critical access issue that my senior advisor of operations had talked about. It's a long-term goal. We've got 3 years until our survey. So this is what we need to do. These are the stakeholders we need, and we're going to start it today. And in 3 years, we'll be good to go. And then just going above and beyond. You take that extra step. You take that extra time with your employees. You really hone into what they want. And you really you accept your type of leadership that's coming from it. There are some leaders where they would not go above and beyond, but then there are some who, this is how healthcare is now. You have to sometimes hold people's hand as a leader, as a manager, and, in some instances, that's okay. So that's transformational leadership and adaptive leadership differences and similarities. And this right here is just my reference slide that I use to pull my data for my PowerPoint. Thank you for listening, and I hope that you were able to learn a little bit more about adaptive and transformational leadership.